question is that currently there are some news coming from CDC that they have changed some strategy, and they're saying that in exceptional circumstances, and there might be a switch to another vaccine for the second dose. And a similar news has come from the UK. I understand that there's lack of clinical data to support this sort of mix and match. But is the province considering something similar, and what sort of exceptional circumstances could these be? Have you received any information from a national advisory on this?
Yes, this is something that we have been talking about with the National Advisory Committee on Immunization for a number of weeks, and of course the fact that some of the Pfizer vaccine has been delayed made that a more urgent question. My counterparts on the Special Advisory Committee across Canada, we've had discussions on this with NACI over the last 3 weekends. The National Advisory Committee on Immunization is re-looking at all of the data that we have available. We're talking to our counterparts in the UK and Israel in particular, who are far ahead with a number of their programs. And as we know, in the UK, they have extended the second dose for longer, for up to 3 months. So we're trying to understand the impact that has on effectiveness of the vaccine. There is some permissive language around using the same type of vaccine, and if you need to replace, for example, Moderna with Pfizer, because they're both mRNA vaccines, they use the same technology, biologic plausibility, and the work that we know about immune systems and how they're stimulated means that they're likely to be interchangeable. But that is a last resort. It's only if the original vaccine is not available that we would do that. So we are still looking for the best advice on that, and whether it's better to extend the second dose, delay the second dose for longer, or to provide the second dose with the alternate product. Right now, we don't have good information to inform one or the other of those decisions, and we'll be continuing to monitor that and to consult on that. We have another call this Sunday about that very issue.
Prabhat, do you have a follow-up?
And I just wanted some clarity that when they say exceptional circumstances, what could those be, except the delays in oil supply? What could those exceptional circumstances be?
Yeah, so if we're at 42 days and there is no Pfizer vaccine available for second doses, we have to make a decision about whether we use available doses of Moderna or whether we extend and wait for Pfizer to become available. So that's the issue. That's the situation that we're not yet in, but that we may be facing. And which is the better of those two to do? There's not a lot of evidence or data to guide that. So we're looking at expert opinion, and is there some populations where you would prefer to delay and other populations where you would prefer to give a second dose with a different vaccine product. So I'm thinking elderly residents of long-term care, for example. It may be more important for them to get their second dose in a shorter time frame. So in that case, would it be preferable to give them, would it be safer for them to receive a dose of Moderna rather than wait an extended period of time for Pfizer? Whereas younger, healthier people who mount a stronger immune response to start with, it may be preferable to extend the delay to receiving a second dose. All very challenging questions that we deal with in immunization programs. Sometimes, the one other situation that we run into all the time is people don't know what their first dose is. So they don't know whether they got Pfizer or Moderna in this case. Right now, that's not as much big a deal, but as we go into population immunization with large numbers of people, that may be more important. And that's why some of our focus is on having our immunization registry, where we can tell exactly which vaccine everybody got and which lot number, which is part of our safety profiles as well. So those are the situations that we're dealing with. This is the reality of planning and being able to be flexible and trying to use the best information we have to make the best choices that we can in the different circumstances.